a.m.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 23 minutes before 11 o'clock. Thank you for tuning in to WOCA this Thursday morning. You know, once upon a time, all doctors were men. Not because they were the only ones qualified, but because we, as a society, we've just been a little bit nutty in the past. So thank goodness we're evolving and we're starting to realize some of the mistakes we've made along the way. The fact that men were the only doctors means even the guy with the best intentions didn't always get women's issues. Just didn't. And I'm assuming there are some exceptions to that as well. But you know, once women started becoming doctors and were working with women, I think a lot of the issues that are specific to women were probably looked at in a different way than when men were the only ones. I'm being sexist, reverse sexist, I guess, in a little way right now by saying that. And I understand that, but I think there's probably some truth in what I'm saying, even if I am being...
Well, you're shouting the facts.
One-sided, yeah. But anyway, so... I think, and when it comes to sexual issues, that's even more taboo. That's even more, has more social stigma associated with it, right?
Yes.
So, again, I'm glad that we as a society are starting to figure out some of the truths about our own selves. Brook Faught is on the phone. She's got a lot of credentials next to her name. She's a practicing nurse practitioner, a clinical director of the Women's Institute for Sexual Health. She serves as an expert in the field of women's sexual health through lectures to professionals and to us, the general public. And that's what she's on the air with us right now to talk about sexual health issues that impact women of all ages. And Robin?
Yes.
I'm not a woman, but I have been pretty much all ages that a person can be.
Yes, you have.
And you are a woman, so thank goodness we're both in the same room at the same time. Brooke, good morning, Brooke. Thank you for being on the air with us today.
Good morning. Thank you so much for having me.
Oh, you're welcome. Where are you calling in from?
So I'm currently in Newark, but I practice out of Nashville, Tennessee.
Newark to Nashville, two of my favorite places, actually.
Yeah.
Yeah. Well, thank you for being on the air with us today.
I appreciate your time.
So when I was talking about how women being doctors made a big difference for women being patients, do you agree with that?
You know, there's two sides to that. So absolutely, and I've seen women that are great medical providers, and I've seen men that are wonderful medical providers. I think the big thing is women sometimes when they're discussing intimate sexual matters, they might feel more comfortable discussing some of these issues with somebody of their own gender. So I think that's where the facilitation of communication on these sensitive topics can be beneficial.
So are there some sexual topics that are more sensitive? Should I close my ears? Should I pay?
No.
Will you and Robin be embarrassed to talk about this?
No.
I mean, are there things that are more...
all day, every day.
Oh, you hear it all?
I bet she does.
Oh, really?
It takes a lot for me to be uncomfortable, so
and
ask away.
Okay, so a lot of... Is any of it our fault as men? Do we sometimes, violate your space, so to speak? I mean, are we part of the problem? I'm hoping there's a no here, Robin. I'm hoping for a no.
It takes two to tango. And so,
Yes.
for a couple that's in a heterosexual relationship, men are very much involved. And I always, I love the fact that when I see my female patients in the office and they bring their male partners, I love the fact that they're involved. And the other thing, too, just going back to the whole advent of Viagra and medications to help with erectile dysfunction in the past, that's been ongoing now for almost 20 years. And it wasn't until recently that the FDA started to approve comparable medications for similar issues in women. As of right now, we have almost 30 medications that can enhance the sexual experience of men, but we only have a handful for women. So we're somewhat evening the playing field, but we're still far, far away from it being completely equal.
Is communication part of the problem between the husband and the wife, or the person and their significant other? Because it seems like when you're young, you're ready to jump all over each other, just have the best time ever. And then all of a sudden, 3 or 4 decades later, that interest kind of wanes. One of the partners might be having something that they're going through emotionally because their physical body is changing, and then the woman doesn't really say anything to the fella because she's embarrassed, and then he takes that as rejection.
Yeah, oh, I see that all the time. And if that's really the main issue, then they don't need me. I'm not a sex therapist, I'm not a counselor. I'm a nurse practitioner, and I deal with the biologic potential causes of their symptoms. But a lot of times these couples will land in my office, and so an appropriate referral is all that they need to maybe help that communication line. But when it goes beyond that, and let's say they have a great relationship and there's no other major medical issues, but they're still having distressing sexual complaints such as low libido, painful intercourse, and so forth, that's when I intervene, and we come up with a good holistic treatment approach to help their symptoms.
So painful intercourse. Now that's I mean, I think any guy who loves his wife would say, "Oh my gosh, tell me if it's painful. We'll do something about that, or we won't do anything. We'll just not to do nothing about the pain, but I mean, we won't have sex." I wouldn't ever want to be a party to somebody being in pain.
Yeah, and I see that a lot as well. Unfortunately, living in the South, women are a little bit different with how they communicate with their partners, and I have a lot of women that do keep that secret from their spouse, and they just come in and they say, "I just want you to fix me, and then I'll go back, and everything will be fine again." So they aren't honest with how intense the pain can be. And 25 to 50% of women after menopause are going to experience pronounced dryness, tissue thinning, painful intercourse. And these conditions are chronic and progressive without treatment. And what that means is if they do not seek treatment and find the appropriate intervention, their symptoms are going to worsen and become potentially even debilitating above and beyond just the bedroom.
Oh, really? My. So what was the phrase you used? Thinned skin? The skin is thinning or something? Could that cause bleeding and infections?
Yeah, absolutely. So burning, stinging, itching, vaginal tearing, bleeding, and then, of course, that equates to painful intercourse. So if it's just mild, sometimes women will use over-the-counter products like lubricants and oils, but if it goes above and beyond that and becomes more of a moderate to severe painful intercourse, that's when medical intervention is warranted. And there's lots of options available. Some of those are hormonal, some of those are non-hormonal. There's even devices. It just depends upon the person, and there's not a one-size-fits-all treatment for everybody, but opening that dialogue with women as the medical provider is really critical to facilitating that conversation. And also patients, even if their medical provider does not bring up concerns, it is really, really important that they are open and honest with problems that they may be having in the bedroom.
Brooke and Robin, I have a request of you two ladies.
Okay.
I have a feeling that our listener ladies have questions that they're never going to call in about because they're too embarrassed.
Yeah.
And but first off, if you're listening and you want to call in, go ahead and call in. Your name we'll never know your name unless you say it. But the phone lines are open. We'll take a little break, and when we come back, maybe between the two of you, we can learn a little bit of something and help somebody out there who is not going to ask the question. I'm guessing.
You have questions.
Yeah, but I'm not living in a female body. How do I wouldn't know what to ask. All right, we'll be right back with Brook Faught. We have to take a commercial break, and we'll be right back. Where's my button?
Thank you.
Located next door to Silver Spring State Park and a few minutes from historic downtown Ocala, our award-winning Holiday Inn Express Hotel and Suites of Silver Springs is a place to stay for a friendly, memorable, and fun experience. Enjoy our fast and free Wi-Fi, complimentary hot breakfast, and free parking. Whether you're in town for work or play, our friendly staff will make you feel right at home. That's the Holiday Inn Express and Suites of Silver Springs, proud sponsor of Friday night Marion County High School football on WOCA, The Source.
Who doesn't love heading out on the boat with a family, hitting the ATV trails with friends, or blazing new stretches of highway with riding buddies? Your toys are your ticket to outdoor fun. At the McDonald Allstate Agency, we get to know you and help make sure you have all the right coverages. Plus, when you bundle your coverage for your car and your home with your boat, motorcycle, RV, or more, you can save up to 30%. So call the McDonald Allstate Agency today at 622-2333 or stop by one of our two Ocala locations at Calla Hills or the Jasmine Square Plaza.
Subject to terms, conditions, and availability. Savings vary. Hi, this is Brad. I want to take a moment to talk about a serious issue. In the next 5 years, the aviation industry is projected to have a shortage of commercial pilots. Now is the time to start training. Ocala Flying Club has started a scholarship for the youth of Marion County ages 17 to 24. The club will donate up to $4,000 towards a pilot's license. This will help get the student on their way to obtaining their commercial pilot license. If this sounds like something you would be interested in, or if you know someone that would be, please contact Ocala Aviation Services, 861-7484.
All right, 14 minutes before 11 o'clock. Thank you for tuning in this Thursday morning. Brook Faught is on the phone. She's talking about sexual health issues that impact women of all ages. And your phone calls are welcome. We don't want to discourage you from calling in, but I can imagine some of you will refrain. And so that's why I'm asking Robin and Brooke to maybe come up with the questions that, Brooke, especially in your case, because you have these questions brought to your attention all the time.
Yeah. So women come to my office all the time and say, you know, what is normal? And my response is there is nothing that's normal. If there is a problem that is distressing to a woman, that warrants a conversation. That's what I would say. In addition, pain should never be a component of sexual activity. And so if a woman is experiencing pain during penetrative play or external play, it's absolutely critical that they have that evaluated by their medical provider to find out the actual cause.
And what if there is no pain until the act of intercourse?
So you mean just at the time of penetration?
Right, exactly.
Mm-hmm. So there's different causes, obviously, to painful intercourse, and it absolutely warrants a physical exam. And so if a woman were to see a medical provider and an exam is not done, I would request that. An exam is absolutely critical to identifying the appropriate cause for their symptoms. You know, just having had a pap smear, a lot of times they're just simply getting that test done, and they're not necessarily evaluating different structures and organs that can help to identify cause of pain.
Oh.
And a lot of times if the patient does not bring that up during that visit, then the provider does not know that, and so they aren't going to evaluate unless that is brought to their attention.
And sometimes when a woman goes through menopause, then she'll go see her doctor, and then the doctor will give her the choice if she wants to be on estrogen or not, instead of telling her yes or no. So is that one of the main causes too, that if a woman doesn't want to go on estrogen because of the risk of cancer, is that one of the causes for the pain?
Well, hormones definitely play a big role, and you know, even women who are on long-term birth control pill use can have sexual complaints with libido and pain, and women who are breastfeeding. So it's not just one category of women, but probably the most prevalent is women after menopause, and it doesn't always occur right away. We typically think about hot flashes and night sweats and cognitive changes with menopause, which over time tend to subside and cease if a woman is lucky. But painful intercourse is something that develops, 3 to 5 years or so after menopause occurs. So a lot of women do not realize that there's that connection, and they think, oh, this is something that'll just go away. They don't realize that this is a chronic progressive condition that's only going to worsen, and they don't seek care. They think that they can just use a lubricant and it's going to, resolve it. But most of the time they're going to need some intervention. And the good thing to know is they don't always have to go on hormones. That might be an option given their history and their circumstances, but there are non-hormonal options and other treatment options that are available for women to consider.
I would imagine that if there was a discussion, an honest discussion between a woman and the man, that he might, because you know how us guys we like to fix things. We'd probably go to this pharmacy and say, hey, what do you got? And he would give some kind of a cream or something, right?
Yeah. Yeah, absolutely.
And what talk about that? Is that a bad thing to do? I mean, that seems
well. In my practice, I've seen some very interesting circumstances. And there's a lot of products, unfortunately, that are over the counter that can really irritate women, and like things with flavors and additives and
flavors.
His and hers warming and that sort of thing. Women can be very sensitive, and if they're already dealing with thin, dry tissue, and then you put a warming product on there, which, by the way, most of those warming products have chemical caustic irritation. That's what causes warming. Imagine what would happen in that circumstance. So if a woman has pain, I strongly encourage a medical consult before they try to self-treat above and beyond maybe just some basic products.
So don't ask the pharmacist. He wouldn't know any more than you do. Unless it was a lady pharmacist, then maybe you get some good advice. What?
You'd be surprised.
Does nature ever, I mean, is it ever just nature saying, look, you're done. You don't do this anymore in your lifetime? Although that's a sad thing to get from nature.
Yeah, it is.
Yeah.
Oh, look at your face.
Yeah. But I mean, it happens in the animal world, doesn't it? Where they say, okay, we're done. We're not making babies anymore. Let's move on.
Right. Well, let's think about this. So back in the early 1900s, the average life expectancy was much less than what it is now. So men and women are living, a third of their lives after menopause, and men, some consider andropause, which is dropping of testosterone levels. So, I mean, sure, we could say, hey, you don't have to have sex because you aren't making babies, but most people like the act of intercourse or sexual activity in general. And so, I certainly have couples in my practice that are coming for a totally different reason, and they say they're not sexually active by choice, and that's perfectly fine if that's what they're both comfortable with. But if it's bothering them that they cannot have sex because it hurts or because they have loss of sex drive, and it's distressing to one or both of them, that warrants medical intervention. And to live a third of your life with a distressing medical complaint it's not okay, in my opinion.
Can an ill-fitting bra give problems to the breasts?
The different parts of the body can be erogenous zones for sure. I don't know of any specific literature on that aspect of things, but yeah, I mean, in thinking about women who have had surgery on their breasts, we definitely hear the complaint that changes to their breast tissue can impact their sexual experience. And also just their perception of feeling feminine. I hear that pretty frequently.
Mm-hmm.
Are we at the mercy of our hormones? You always hear this stuff that if you're lacking drive, you need testosterone or estrogen. I mean, are we really? I mean, is that? I mean, are we just like, machines, and you put this oil in and you start working better?
Yeah.
Beware of the one-size-fits-all approach. There is no such thing. And once again, my patients, and I think most of us that treat sexual health conditions in female and male patients, we really treat from a comprehensive standpoint and a holistic standpoint. We really look at the patient as a whole and really try to figure out what is the ultimate cause for their symptoms and what the best treatment approach is. And there's never just a magic pellet or a pill or whatever that's going to fix everything.
So the male pill, the Viagras and whatever else there is out there, it seems like it's a physical fix. There's something physically wrong that's not happening, but there's a drive that wants that physical thing to happen. Is it the same thing with women? Is there a physical thing, or is it because if you say libido is low, that sounds like an emotional thing.
Yeah, so libido or desire is, we joke, we say, don't say it's all in your head, but I mean, technically it starts in the head with the neurotransmitters in the brain. Just like depression, the medications that we use for depression work on neurotransmitters in the brain. So that's a piece of it. Then there's hormones, then there's nerves and blood vessels and muscles, and a variety of other things. So that's why it's so complicated, and it's not appropriate to say, just do this, just have a glass of wine, just go on a date. And if that does fix it, great. But if it doesn't, then there's something more going on from an internal mechanism. And it is difficult to treat. We can't necessarily test neurotransmitters from an easy fashion. And so a lot of it is trial and error. But really taking into consideration the woman as a whole and as an individual can really facilitate a proper treatment plan.
If a woman becomes very active in her early teens, is she more prevalent to having cancers and things like that?
That's kind of above and beyond what we're discussing here today, but yeah, there's definitely a possibility of further sexual issues, but at the same time, I also see women that maybe have abstained for a long period of time and for a variety of reasons, by choice or just lack of partner, and that can lead to problems as well. So knowing that the age of onset of sexual activity is relevant for a lot of factors, what we're talking about today, not so much specifically.
So are you seeing anybody in Newark? You mentioned earlier something about the southern women. Do the northern women have a different way of talking about this?
Well, I trained in Philly, and now I practice in Nashville, and I had to completely revamp how I interact with my patients because, what their comfort level is and the way that they communicate is very, very different.
Oh, really?
And so, yeah, I mean, if I used the tricks and techniques that I learned in Philadelphia and Nashville, I probably would not be very successful.
That's interesting, isn't it? Especially in Nashville. I thought Nashville was like the Los Angeles of the South.
Yeah.
Not really, huh?
It is. It is.
Oh, it
but,
is.
I see there's so few people in that treat sexual medicine that I see women from multiple different states. So even further on south. But yeah, Nashville is it's a wonderful melting pot. But we see women from all walks of life, and some of the women that are from the deep south. This is just not something that was openly discussed growing up. So treating them with respect and coming at them from something that they consider to be their comfort level is really critical to facilitating an open conversation.
Will the women get the same results from seeing a female practitioner than they do from her male counterpart?
I have seen wonderful female providers and I have seen wonderful male providers. And I really don't think that's as much of an issue as we would think. It really just depends upon where they receive training, where their interests lie. And as long as a medical provider, even if they are not familiar with the best treatment option for a woman's symptoms, if they take them seriously and they refer appropriately, that's really the most important thing.
So when you work in Nashville, do the Southern women have different euphemisms? Do they call body parts by what they're called, or do they have pet names?
That's actually a funny question. Yeah, body parts are definitely referred to by different names.
Oh, man. I would love to hear that conversation. Somebody with a Dolly Parton accent. I don't want to do it.
You never know.
I almost did it. I almost tried to do that, but I don't think I could do that.
When a woman is experiencing discomfort or something else, would it be better for her just to make an appointment with her doctor for a consultation, and then after they talk about it, to go ahead and make it for the examination, or should the whole thing be done at the same time?
I think what's important for women to consider is bringing up their concerns at the beginning. A lot of times uncomfortable topics are left to the end of the visit. And if a physician or nurse practitioner or PA knows that this is a priority for them, then they're going to spend a little bit more time during that visit dealing with that particular issue. So that would be one of my biggest recommendations for patients.
Brooke, thank you for being on the air with us today. Brooke is with the clinical director of the Women's Institute for Sexual Health, which forms the acronym WISH. And I understand you have a website. Can you give us that website?
Right, yeah, so wishnashville.com, but also a couple of really great resources are painfulsexaftermenopause.com and ISWISH, which is the International Society for the Study of Women's Sexual Health.org. So ISWISH.org is a wonderful international organization that can help both medical providers and the general public find local resources in their area for medical professionals that treat sexual complaints in women.
All right. Thank you for the great information. For everybody who wants to share this with somebody you love, we have recorded this. This will be online by about 2 o'clock today. Thank you so much, Brooke.
Thank you so much for your time. I appreciate it.
All right. This is WOCA Ocala. We'll be right back.
The Source.
This is a Fox News Alert. I'm Lillian Wu. History being made on Capitol Hill as the Pope becomes the first ever to address a joint meeting of Congress.
I am happy that America continues to be, for many, a land of dreams.
Pope Francis telling his audience, made up of Supreme Court justices, cabinet officials, and lawmakers from both parties, that they should defend and preserve the dignity of all Americans. There may be a breakthrough in the mystery surrounding one of the best-known paintings in the world.
Researchers in Florence say they think